Nawal, it's nice to meet you. Can you tell us a little bit about yourself?
So my name is Nawal. I am originally from Ontario, Canada, and I grew up in Toronto for majority of my life. For undergrad, I went to Western University and I had the best time in undergrad. I was able to study health sciences and disability studies. And then post-graduation, I was really able to explore like various different areas of interest within healthcare. So that was really awesome for me. And then in terms of my hobbies, I'm a big knitter. That's something that I love doing in my time. I'm currently working on a sweater for the winter in Calgary. And I also love to do Lego. So I have like mini Lego sets all around my room, which is fun. And that keeps me busy.
So, can you tell us where you are now?
Yeah, for sure. So I recently moved to Calgary for PA school. I moved at the end of August. And yeah, I've been living here for the past 2.5 months. I really love Calgary. I've never been there before. I know, Anne, we were talking that you haven't been here as well, but it's really like the perfect mix of city life as well as the nature, and it's really nice. I'm loving it a lot.
So, can you tell us a little bit more about what drew you to the PA profession? Like, how did you first hear about it, and what inspired you to work towards becoming a PA?
I think I actually heard about the PA profession like pretty late in my journey in healthcare, but I can kind of start about like what inspired me to go into healthcare and then how it transitioned into the PA profession. I would say that my inspiration for really being interested in healthcare was kind of like a combination between lived experience as an immigrant as well as like my previous educational background in health sciences and disability studies. So, as an immigrant, I was able to see how navigating the healthcare system can be very challenging. And then also navigating that with my mom, who has a chronic illness, I was really able to understand like, there are barriers in place when people have chronic illnesses, language barriers, and then also just the added difficulty of when you're working with a practitioner, how your healthcare can vary. So, when you're working with someone that has the time to dedicate to you, how that can be so beneficial to your health. And then when you're working with healthcare practitioners that are so overburdened that it can make you feel less supported in the system. And then, so I knew that I had this interest in healthcare from a young age. And so I did my background in health sciences and then a minor in disability studies. And that really showed me how various different social identities can intersect to create unique experiences in healthcare, often amongst like marginalized populations. And so I knew that I wanted to work in healthcare to improve access to care and also provide more specialized care for marginalized populations to help support them because often they're the ones that are, falling through the cracks of our overburdened healthcare system. And then when I learned about the PA profession, it was quite late into my journey. I was looking at a couple of different professions within healthcare, but I came across it on Instagram. And then I think Anne's page was one of the first ones I saw. And after that, I wanted to learn more. So I, shadowed a PA, got to see what that was like. And I found that it was like the perfect profession that fit my interests, which is again, increasing access to care, filling in those gaps within the healthcare system so we're able to better support our patients and different populations within Canada. And then also just providing patients with more face-to-face time with a healthcare provider, which I think is so important to make sure that the care we're providing is actually going to be matching their needs and their lifestyle.
So, were there any other healthcare careers that you were considering apart from PA?
Yeah, so I had actually explored a couple of different fields, as I mentioned. Before this, I was interested in going into med school because that was kind of the only thing I knew within healthcare for a long time. So I did get to, work in a primary care office and kind of learn about that as well. I worked as a physiotherapy receptionist too, so I was able to learn a little bit about physiotherapy. And then my most recent healthcare experience was as an occupational therapy assistant. And so that was also something that for I would say a year and a half, I was really considering as well. I love the OT profession and the creativity that's involved in it. But ultimately, once I was able to learn about the PA profession, I knew that that was like the best fit for me.
In terms of gaining your healthcare experience hours, was
Mhm.
it challenging to find those experiences, and how did you make the most of it once you secured those experiences?
Yeah, so I think healthcare experience is super important, especially for the PA program. Being on the other side of it when I was applying, I was like, okay, this is just something that I need to check off. But as a student now, I can see why it was so important. We really jump into the curriculum so quickly. So having experience with patient interaction, intercollaboration. It's so important. And having that experience is just going to help with the transition into the actual role, but also into your learning as a PA student as well. So I definitely was nervous about finding patient care experience. I didn't know what constituted as patient care experience. I was also so nervous, like, right out of undergrad, how am I going to get a job where, they would allow me to have that type of interaction? Um, what I found was that for a while I was looking through and trying to find these jobs, but honestly, I would say the best way to do it is through your connections as well. Like talk to people that are in spaces that you're interested in. So for me, that looked like, I went to a physiotherapist and I as my own for my own treatment, and I was like, I'm really interested in this. Like, we built that kind of connection over time, and then having her learn about my interests, she was able to really recommend me to a clinic that she knew that was hiring. So that's kind of how I got started with my physiotherapy receptionist role. um, and then in terms of the occupational therapy assistant role, I found that people get nervous to reach out to people online, but that is my favorite way to build connections. I message people on LinkedIn all the time. I message people on Instagram all the time. The worst thing that can happen is that you don't get an answer or you get a no. And the best thing that can happen is you can get a really awesome experience. And that's what happened for me. So, get over those nerves. It can be tough, but you never know what kind of experience you can get if you just put yourself out there. So that's what I did. I reached out on LinkedIn to an occupational therapy clinic in Milton before I actually moved there. And we kind of were able to talk back and forth and discuss my interests and what I wanted to learn. And then when I got to Milton, I started off as a volunteer actually. So that was a great segue too, is starting off volunteering so that they get to know you, build a relationship with you, you can have more flexible hours. And then when I was able to start working, which was, I think, 1 month or yeah, 1 month before the PA application deadline, that's when I started actually getting more work experience within the OTA role. And because they had already known me, they were able to really give me more autonomy within that role as well. And like I was able to do a lot more than I would have if they didn't have that previous experience with me. So it can be challenging to get patient care experience, but it's incredibly important. And then I think the second part of your question was how to make the most of those experiences, right? So one thing that I remember really noting down, it was a huge tip in one of the videos that I had watched about previous PA students. They mentioned to keep a journal so that you can reflect on your experience. And I think that is the best tip that I've heard. Every day, I would kind of, at the end of my shift, I would write into my phone the date, the patients that I worked with or the clients that I worked with that day, and what I learned, what I saw, and how that experience can possibly connect to the PA role. And I think that was really helpful because when I went to go write my application and prep for my interviews later on, I already had this this toolbox of all of my different like experiences and things I had seen. And so, yeah, I would definitely say be heavy on the reflective aspect. That's really going to help you in the long run for your applications and in your development as a learner too.
It sounds like from these experiences that you were able to obtain pretty strong references as well. So can you tell us a little bit about what that process was like for you?
Yeah, I know like asking for references can be super nerve-wracking. That was something I was nervous about too, because I felt like, you don't want to bother anyone, but also these are people that care about you and your journey, right? So if you've maintained those relationships, they're going to want to see you succeed. So definitely through my occupational therapy assistant role, I built a really great relationship with my manager, and she was the one that I'd work with every single day. So she was able to see me interact with patients, see how I pre-planned sessions, and really work with me one-on-one. So I wanted people that had that kind of input and outlook. So it was nice to have such a close relationship with her. And she wrote one of my references. And then in addition to that, I also wanted to balance my references. So, I had one referee that was based on my patient care experience, and then I wanted one that could talk about my academic strengths as well. So during undergrad, it's really important to build those relationships with your professors. I know it can be challenging, but it really not only does it benefit your learning experience, but then also post-graduation, it's easier to ask for that reference as well. So I had one professor from my disability studies course that we were able to develop a really great relationship with. And I actually am still doing research for her now. So not only did she see me as a student, but also now as an employee. So she was able to talk on both of those aspects. So asking her was a little less scary because we had already built that relationship. And I know that she could talk about my character as a person in addition to, my strengths as a learner too.
What role do you think your extracurriculars and leadership, as well as community involvement, had in helping you be a stronger candidate for PA school?
I know that with PA applications, it can be really competitive. There's a lot of applicants that are applying each year. I think a lot of the characteristics that PA schools are looking for are people that can communicate well, that can organize their time, that are people that want to give back to their community and support the people around them. So a lot of the extracurriculars that we do help us develop these goals as well, or these skills as well, right? So I kind of felt the same way, like as an undergraduate student, getting involved in my community was something that I was very passionate about. I felt that for me, being able to shape the experience, not only for myself in undergrad, but for other people around me was really important. So that's why I joined student council and food support services on campus. And I found that being a part of these clubs really allowed me to learn about not only like how to communicate with other students, but then also how to understand what the needs are around me, specifically in my food support services role, I think is seeing what the people around me need most and how I can use my skill set to kind of provide or support them in that role. And I think that's kind of like what a PA does as well, is like understanding what your patients need and what kind of services are required within a community, and then being able to uh, as a PA, find out how you can fill gaps in healthcare to support these patients. So I think a lot of the times, like our experiences provide us with those soft skills that are beneficial in our role as a PA, but then also they can also provide like I guess different experiences with people that can make it beneficial as a student as well. I think in addition to that, it was just also a different environment in undergrad. So, you can get caught up in your studies, and that's really important, but it's also important to have balance in your life. And I know for me, extracurriculars always provided like a a break from studying, and it was just beneficial to my overall well-being. So that's something that I did in undergrad for that reason, but I also found it beneficial in other sectors too.
So can you tell us a little bit about your undergrad stats when it came to when you applied? Like, was this the first time that you applied? What was your GPA, if you're comfortable
Yeah.
sharing that number of healthcare experience hours? So some of those stats, if you're willing to share with us.
Yeah, for sure. So this was my first time applying, my first application cycle. I know in undergrad, it can be difficult to maintain a GPA all throughout all 4 years. I definitely wasn't somebody that had a crazy high GPA in first, second, or maybe even third year, honestly. But I knew what my goals were, and I knew that in to get into the healthcare field, grades did matter. It is one of those checklist items. And so even we know for different PA schools, they have GPA requirements. So I really figured out my learning style by third and fourth year, I think. And I did 5 years to kind of finish off my minor, which I think helped. But I believe that a lot of the PA schools look at your last 2 years of undergraduate studies. I believe my cumulative GPA was around a 3.7. And then for my last 2 years, I was really able to put in the work. Again, working one-on-one with professors really helped me to go over the material. And I believe I ended off my last 2 years with a 3.9. So that was a big jump for me, but I knew that it was something that would really help me with my applications. But that being said, your marks aren't everything in your application. We mentioned extracurriculars, but there's also other lived experiences that definitely go into play of you as a person. Your marks don't define you. So if that's something that you're struggling with, you can definitely get support with that to kind of raise your marks. That's kind of what I did. But then in addition to that, know that it's not the only thing that's considered as an applicant, right? And then in terms of my patient care experiences, it was different for each school because I think schools had different deadlines for applications. So for U of T, I know I was on the lower end of hours, and I can't remember the exact number, but I believe I did finish off right before the application cycle ended with around 350 hours, maybe a little bit more than that. But again, the more experience that you can get in a patient-facing environment, I think the stronger applicant that you will be, and the easier the transition will be for you as a student and then as a working PA as well.
PA schools did you apply to, and what was the outcome of that?
For sure. So I applied to all of the PA programs in Canada at the time. So that was McMaster, U of T, Manitoba, and then Calgary came out in February. So I was a very last minute application, but I'm so happy that that happened. I was granted application into McMaster and then Calgary after that.
Oh, that's incredible. And how did you end up picking between PA schools?
Yeah, that was actually challenging for me. McMaster was a school that I originally thought I was going to go to for sure. But there were a couple of different factors that came into my decision making. I'm the type of person that says, it's not only important what you're doing, but where you're doing it, because I think that's a huge part of your journey. And for me, I had already experienced what school or post-secondary education looks like in an Ontario setting, and I was ready for an adventure. I wanted to get out of my comfort zone, and the West Coast was somewhere that I wanted to live for a while too, actually. So that definitely played into the decision making. But then I think it's also really important to look at what the school provides, the structure of the curriculum, the opportunities that you might have there. So that was really big for me. What I liked about both schools was that it is in-person learning. I know that that's kind of where I do the best. So I wanted to make sure it was an in-person school. I also wanted to make sure that it was a school that involved both didactic learning as well as the small group learning, because I think for me, the mixture of both is really beneficial. So with the Calgary program, we have classes as a larger group, and then we have small group mandatory sessions where we work on cases. And I think that's where the learning really solidifies for me. So looking at the curriculum, that's kind of what drew me to Calgary as well. And then also just the idea that as a PA in Calgary, you're creating the path for other future students, right? It was the first class, and I knew that with that comes really unique experiences as well as challenges for sure, as we're trying to navigate how the system will work. But I come into class every day, and the specialists that are teaching us every day that are on rotation, they're always like, we are so excited for you guys to join us. Like, we can't wait until you graduate. And that feeling, I think, is so unique. Whereas in Ontario, PAs are definitely more developed and there are benefits to that. But in Alberta, I think being able to pave the way and be the first class was an experience that I really thought was unique, and I really wanted that. And then also looking at class size. So just this year, I think McMaster had increased their class size pretty dramatically. I think from 30 something students to 50 something now. So looking at that, I knew that for me, my learning is best in an environment where there are small class sizes so I can have more one-on-one time with professors, but then also it changes the kind of atmosphere for learning as well. I know every single one of my classmates. I feel so comfortable working with each and every one of them, and being able to work in a smaller class size where I think my program has only 20 people. That really allows us to, again, get to know each other so much better, but then also it creates more of a community feeling. And so that was a big driving force in choosing Calgary too for me.
That's wonderful. And congrats on the multiple acceptances. So
Thank you.
that's really speaks to how hard you worked during the application process. Speaking of the application process, I know that each of the schools have different processes, and you're managing multiple applications at the same time. Were you also
Mhm.
studying at the time and working at the time that you were applying?
I wasn't studying, but I was working. Yeah.
Okay. So, can you tell us a little bit about how you prepared for the PA application process, apart from the journaling and
Mhm.
accumulating hours? Like, what tips would you have in terms of balancing and keeping track of all the different moving parts of a PA application?
The application process can be really exhausting and overwhelming. And when you're applying to multiple different schools, you're not writing just one written application, right? You're tailoring it to the school, making sure that you are showing that you not only know about the school, but you're using the experiences that best match what they're looking for. So it's definitely, you do need to tailor your application, which can take more time and effort, but it's definitely worth it. But you do need to figure out a way to manage that workload as well, and it can be challenging. For me, I think the one thing that I did was to start early. I know everyone says it, and it's so hard to do, but if you're working on something 5 minutes a day for a few months, it's going to be a lot easier than having to do it like the night before, right? So, and it allows you more opportunity to kind of play around with material, things that you like and don't like, and rewrite versions as well. So I definitely started early on in the process, I think right when applications came out. I know for McMaster specifically, there was no written application. So I kind of got that out of the way first because it was just providing your stats. And I don't think there's references either for McMaster. So I got that application out of the way pretty quickly so I could focus on U of T and Manitoba at the time. So for me, preparation was like putting in my calendar the days that I wanted to really dedicate to work on my application. I was working at that time, so I needed to make sure that I could fit that in my schedule. and really dedicate time to it. I know for me, like if it's not in my calendar, I'm not going to treat it as something that I need to do. So I definitely put it in my calendar to work on every week. I can't remember how many hours I had spent each week, but because I had started on early, it wasn't like I was doing a bunch of hours each week. I did have more of a relaxed schedule at the beginning. And then I also found that for me, it was really important to get the support of people that had gone through the process already. So that was mentors online like Anne. And then I also worked with other mentors as well to kind of go through the brainstorming process of what I wanted to really communicate as an applicant about myself to these schools. Having that again is like a reflection piece in itself too. So I started that early as well. And then making sure that I had a checklist of everything that was required from the school. So as I was going through, knowing when I wanted to send my professor reminders to just let them, I give them a heads up that, hey, my application's due in a month, just to give them that heads up so that it wasn't creeping up on them. So that was definitely one thing I used to manage my time as well, was those different checklists to manage like what I had to do. For example, I believe I also had to do like in addition to the written application, some schools had surveys that you had to complete. I believe UFT was one of them where you had to complete like a survey of each healthcare experience, explaining it and kind of providing the hours that you did. So that was added on to that as well. But overall, for UFT and Manitoba, I tried to get my written application finalized and the revisions done, I think, at least a few days in advance so that I can actually have time to look over it myself before applying or before submitting the application. But then for Calgary, because the application only had come out in February and was due very soon after, it was definitely a completely different timeline. I was dedicating more time to it each and every day. I did have the material that I used for the other schools, so that was helpful because, your experiences pretty much stay the same. You can kind of transfer those over, but tailoring it to what they were looking for and the questions they asked was still a challenge in itself. But then creating that schedule for myself really helped. And again, working with PAs that have had experience with the PA application in Canada was really helpful for me as well. They helped me kind of guide me through that process and make sure that I was able to present myself in the best way possible. Yeah.
That's wonderful to hear. And how soon did you hear back about interview invites?
So for McMaster, there was a online interview as well, but it was a Kira interview. So not your traditional interviewing style. It's more of like they give you a prompt on a screen and you kind of answer those in a recorded time. I don't remember how early on I actually heard about these. I believe for for McMaster, it must have been in February. And then for Calgary, I think we heard back in March, at the end of March. And I do remember that our interviews were on Mother's Day. So I think it was the end of March and then interviews on Mother's Day. Yeah. But usually, I think you find out just a few weeks before your interview. So you do have time to prep, which is great. But I did start the preparation process pretty early on, even before I had received interview invites, because I wanted to make sure that if I was to get an interview, I was already kind of ahead of the game in terms of prepping. Because interviewing in itself is it's a difficult skill to have, especially when there's time restraints and different interviewing styles. So I was definitely prepping pretty early on for that.
Do you have to also do the Casper test for any of the schools that you applied to?
Yeah, I did have to do the Casper test as well. I believe I did that at the end of the previous year. So it must have been like it was the last date for Casper available. I do think it was either November or December that I did the Casper in. And for that as well, I did end up prepping a lot for Casper. Um, I think one note about the Casper is that it can be difficult for some students. Like for me, especially, I don't think I did well on Casper, but it is something that schools look at. And that was something that really, it brought me down for a while when I saw my Casper score initially. I was like, oh my goodness, like how am I going to get into school now? Especially Calgary and Manitoba look at Casper heavily. McMaster, I don't believe looks at Casper anymore, but they do their own initial Kira and then a secondary Kira as well. Um, but, that being said, it's still possible. I'm still here in school. So I think knowing that one aspect of your application doesn't determine your fate is really important. For Casper, I ended up prepping a lot and I didn't do well, but there are people that didn't prep for as long. Maybe they did like 1 or 2 days of practice tests and they ended up doing really well on it. So I think maybe my main tip for Casper would be to maybe not fall into the scheme of, each answer has to have this, this, and this. You have to fit this in within a time frame, but really answering the questions authentically, being able to reflect on your past experiences, being able to maybe not overdo the practice, but really spend the time reflecting on your experiences and knowing how to tie them into your answers. That's probably the main point.
For those that aren't familiar with Casper, can you
Mhm.
kind of explain just briefly what it is? And then,
For sure. So the Casper test is a standardized test that looks at your social and emotional intelligence, is kind of my understanding of it. The way it works is there are written components as well as video components. So you do it online, and once you enter this kind of workspace, they give you a prompt. You have a few seconds to kind of think about your answer, and then you are led into either questions that are written questions or audio recorded or video recorded answers. So sometimes the Casper can be like written prompts or videos. So they will give you like a scenario played out for you and ask you what you would do in response to this scenario, or what do you think the right thing is to do in this situation. And so it's really looking at your ethical judgment as well. So for me, prepping for the Casper involved a couple of different things. The first one was to learn about medical ethics. So I was able to read a couple of books on that as well. I believe the main one that I read was Doing Good. And I know that's one that's recommended to a lot of people. I actually found it really helpful in terms of going through different ethical dilemmas within healthcare and working through it, because there is never one like ultimate right answer, right? There are gray zones within each answer as well, and being able to understand them is really important, and reflect on them is also very important. So reading that book early on really helped me, and then being able to do the practice tests that they provide. And then I also spent a lot of time with one of my friends just practicing, because she had to do the Casper as well. So we would go back and forth with different practice Casper questions. And I believe there's a huge list on BMO. Like there are hundreds of you can go back and forth. And they have samplers provided as well. I would keep it that a lot of the samples can make it seem like you can fit a lot within the time frame that you have to answer. But don't compare your answers to that sample answer completely, because I didn't fit that much information into the time provided, but just being able to hit the main points, provide your reasoning as to why you would do something. And then also the main thing I think is connecting it back to a lived experience if you have the time to. So my preparation really involved reading, practice questions, and then getting familiar with just medical ethics in other ways through YouTube videos, or sometimes people on Instagram also provide practice questions. So doing those as well and seeing how they answered them versus how I would answer them, that was helpful for me as well.
and is typing speed, sometimes I see that as a
Mhm.
recommendation for Casper test. Like, how important do you think that is in terms of being successful?
Yeah. So I do think at the beginning I was really worried about typing speed as well, because you are very limited with the time that you get, and being able to hit all of the major points can be difficult in that time. I did start off by trying to improve my typing speed with one of those online games that they kind of let you, like, you have to race somebody to type out all these sentences. But I found that as somebody who is a slower typer, I wasn't going to see those advances in my time or improvements in my typing speed as quickly as I needed, because I was only a few, like maybe 1 or 2 months out. I wasn't going to be able to increase my typing speed in those 1 or 2 months. So I stopped focusing on that, and instead I started focusing more on being able to communicate more concisely, but also being able to, while being concise, include the most important information. And again, I'm not sure if that's the best strategy, as I wasn't somebody who did really well on Casper, but I think that I don't know how else I would have been able to improve my speed in such a short time. I'm sure if you had been working on it for a couple more months, then maybe that's a possibility. But I would say focusing more so on being able to type out your answers in a concise manner, but still including language and yeah, language that can kind of communicate what you're trying to say more quickly is important. And then being able to, again, have those reflections of your experiences so that you're not spending too much time thinking about how you want to say them, because you've already kind of done that part, right? And just figuring out how to connect them more quickly. Yeah.
Okay, so there are some similarities between preparing for Casper test and the PA school interviews. So if you could sort of segue into how you prepared for PA school interviews.
So I had found out about Casper before, like my Casper results before the PA school interview. So I knew that I had to change my approach, because clearly what I was doing wasn't as effective. But I think for me, shifting away from that clear cut, like cookie cutter method of answering questions and kind of creating my own strategy of how to answer questions was the game changer. So Casper was helpful in the sense that I was able to already go through those medical ethical problems and situations and how to work through them. But I found that when I was practicing for MMIs and Kira, I was leaning more towards my experiences and how they would help me as a student at the specific school. So, for example, for McMaster, I would talk about how my learning experiences in undergrad, where I got to see online learning and in-person learning, helped me identify that I'm better at learning in an in-person environment. And then also the aspect of, I believe at McMaster, they have a lot of problem-based learning, and how I was exposed to that in undergrad and was really able to develop that skill. So knowing what the schools offer and how your past experiences can make you a good fit for their program is super important. So identifying those areas and incorporating them into your answers is kind of what I focused on with the MMI. And then again, the MMI for Calgary is very different from the Kira interview. So I prepped for them in a little bit of a different way. For the MMI for or not the MMI, but the Kira interview for McMaster, I definitely had more of a structured way of answering. So it was like, identify the question, kind of provide an answer for that question, and then link it back to my experience as a candidate, because you always want to have that piece of linking it back to yourself as a candidate. And then for the MMI for Calgary, because the timing is a little different, you do have more time to answer questions. For me, it was an online interview where there was an actual other person on the other side of the screen, so that made it different as well. So when I was practicing for the MMI for Calgary, I made sure to mimic that kind of environment. I had people on Zoom practicing with me. I had people practicing with me on Teams as well, just making sure that I was used to seeing somebody else on the screen for that interview. And then again, for the MMI for Calgary, because there's more time learning, that I can now transition from more of a shorter, compact, and concise response to then delving into each of my arguments for questions, right? So being able to provide more of my viewpoints and decision making in situations. Why am I thinking a certain way, and what's leading me to look at, like, what are the different perspectives that I need to consider when looking at different situations that are provided in these questions. So I took more time with that, and it was difficult to switch from the different types of answering. But I think the most important thing is the practice that you're putting in. For me, I practiced a lot, and I think I practiced like every other day with a different person so that I can make sure that not only am I speaking in a way that somebody who's been in healthcare can understand, but somebody who has never stepped foot in health in a healthcare class or has no experience with this type of material can also understand, because you have a variety of different reviewers when you're doing the MMI. I was able to watch a lot of like videos online about how people went through answering their MMI questions in terms of like strategizing their time and building an argument. So I was able to use that as well.
You seem to be very comfortable in terms of speaking, like your eye contact, your flow of words, you just seem very professional and very comfortable. How do you develop that skill, and what advice would you have for people that really want to be able to communicate better?
I think communication is one of the most important skills to have, again, because you're going through an interview process for a lot of these schools. But then also as a student, being able to communicate with your peers, being able to talk to your professors in class as well. So communication is definitely one of those skills that is important to develop early on. I think for me, my style of communication really developed early on because I was involved in those extracurricular activities. As I mentioned before, they do help you build a lot of the skills that are important for different aspects of the application process, but then also as a student, and communication is one of them. I got involved with council very young. So in middle school, I was always on student council, and I feel like that kind of broke the ice for me in terms of presenting to people. And actually, presenting is something that I really, really do love to do. So it's something that I was very nervous about as a kid, but putting myself in positions where I would have to do it more often really helped me become more comfortable in the space. And then in university, I would say that I also seek these types of opportunities. So I was involved in a lot of case presentations. So I did a lot of competitions in terms of healthcare competitions where we would come up with an idea of how to solve an emerging healthcare issue and then present that to a panel for various different, like, sometimes it was scholarships, or other times it was funding to develop this project that you were interested in pursuing. So I think those actually helped me the most with becoming comfortable speaking to people. But then as interviews happen in an online setting, I think it's important to be able to translate that comfort in front of a camera as well, which can be more difficult to do. But again, having those practice sessions with other PAs or PA students, and then people that are already PAs, and as well as my family as well on Zoom, I was able to get comfortable with looking into the camera, being able to maybe stop looking at myself on the screen, because that can be really distracting when you're doing your interview as well. And I think that's really helped me develop that skill as well, of feeling comfortable speaking in front of the camera, and in a way that's still engaging in an online setting. Yeah. Transitioning into graduate school or PA school, it's a tough transition, but then I had this like added layer of moving provinces and moving away from my family. Granted, it is the choice that I wanted. As I mentioned, I really wanted a new change of environment. I know I grow the most when I'm out of my comfort zone. So I really wanted to provide myself with that opportunity as well. So picking Calgary was very intentional for me. The process can be challenging. I mean, you're leaving everything you know for a new environment, a new living situation. The weather here is so different from Ontario. So even just adjusting to that is a big adjustment. Find myself wearing so many more layers here. And I actually experienced my first Chinook yesterday, which was so exciting, which, if you don't know, is like this random day of like hot air passing through. So you feel really warm where the rest of the days were really cold, which was a really cool experience, actually. And I was really excited about it. But going back to what you were asking, it can be really challenging to move and make that transition. But I think I'm so fortunate that my classmates are the most amazing people. Like, I've been able to make friendships with people that are so supportive, and everyone in my program is just really has each other's back. And, everyone's going through some kind of transition of their own. And recognizing that, you can kind of leverage that shared experience to support one another, and it helps you develop those bonds even more, I think. So for the people that have also moved from Ontario, I know that we have that kind of special bond in the sense that we know what it's like to live there. We know what it's like to live here. And it's been a big change for us, but having to know that other people are also going through a similar situation is really comforting. So spending time with my classmates has been the most beneficial thing for me. And then also keeping connected with the people that you love the most throughout that transition as well. Like, I talk to my parents every day. I have friends that I call weekly to make sure that we're still keeping up with our relationship as well, right? So as I mentioned, I'm really into knitting, and I used to be in a knit club in Milton. So I miss my knitting ladies so much there. But sometimes I hop on Zoom and I'll knit with them over here. So it's really about maintaining those connections that helps you during that transition. And then in addition to that, I would say give yourself time for settling in. It is a huge transition, whether you're moving cities, provinces, not moving at all, just starting school. There's going to be a period where, especially at the beginning, for the first 1.5 months, I wasn't able to do the hobbies that I was doing regularly because I was so overwhelmed with this new environment and my curriculum as well, right? It's a very fast moving curriculum. The PA school is only 1 year of actual like learning in class, and then the second year is transitioning into placement. So give yourself some time to adjust to that environment. It's okay if you aren't able to go to the gym as regularly, you're not able to do your hobbies as regularly as you did. You're picking on a huge new challenge. It's going to take time to adjust. For me, after that, I think 1.5 months, I started to feel more into my routine. I felt comfortable with, I had to cook for myself, clean, go grocery shopping. There are other aspects to being a human. So being kind to yourself with that transition period is really important. Things will start to fall back into place. I've started to start my hobbies again. I've re-entered the gym scene, which is great for me and my mental and physical health. And it was awesome because I was able to have like my friend within class to go to gym with as well. So making sure that you give yourself that time, aren't too hard on yourself when you're not able to adjust back to your normal routine right away, because this is a huge change. And then in addition to that, as I mentioned, like having your friends within class, so being really intentional with that, I think is so important, because in the PA program, you're really only together for that first year. So I'm really trying to take in every opportunity that I have to go out with my classmates, whether that's after our Friday quizzes, which we have quizzes every Friday. So if we're going out for lunch or dinner on that day or on the weekend, making sure that I'm able to either have some kind of social event that like really allows me to bond with them, because you're not going to have that time for so much longer. So it's definitely a priority for me as well.
Can you also share a typical day in the life or week in the life of a PA student at Calgary?
So I think Calgary's curriculum's a little bit different from each program, which is, I love Calgary's curriculum. It kind of is a 2-day rotation. So on Mondays, Wednesdays, and Fridays, we start off with our fundamentals courses where we kind of learn like the physiology, diagnosis, management of different conditions. And then in the afternoon, we're going through our foundations, which are like either ethical principles within healthcare, social aspects of healthcare, like social determinants of health. And so those are Monday, Wednesday, Fridays. And then on Tuesdays, we're doing like medical skills and small groups, and Thursdays as well, medical skills and small groups. So my day varies a little bit, but one thing for sure is it is like a job in the sense that you're going in at my classes start at 10 a.m. and go until 5 p.m. So I'm there from 10 to 5 on campus. I wake so for me, I wake up around 6:30 to 7 a.m. each morning. It allows me some time before classes start to just like go over material that's going to be covered in class so that I can feel a little bit more engaged in lectures and participate as well in the discussions. And then getting to class, I'm in on campus from around 10 a.m. to 5 p.m. each day. And as I mentioned earlier, the days kind of are on a 2-day rotation. So depending on the day, my classes look a little different. On days where I believe Monday, Wednesday, and Fridays, I also like to go to the gym in the morning so that I can kind of get my workout early on. And that actually helps me concentrate a lot better in class, I find, which is nice. So I go to the gym with my friend, one of my classmates, and then go straight into class from there. And then after class, I come home, give myself a good break. I want to make sure that I can like cook, eat, watch a show if I can, and then go into studying. And it gives me kind of like a mental break because you can't, if you're going from 10 to 5 the whole day, jumping back into class material can be exhausting. So I spend a few hours doing that each night, but not too many hours because I know that that can, I want to make sure that I'm also doing the other things that are important to me as well. And then I try to go to bed by like 11:30, 12 each night so that I can get a decent amount of sleep for the next day as well. I think what's also interesting is that with Calgary's program, because we have that weekly quiz on Friday, and I'm not sure if this is something that's going to be continued on until next year, but right now that's kind of how our curriculum's formatted. I like to take Mondays or Tuesdays to kind of have more of a fun activity to do after school. So last week I was able to go to this really fun anatomy art workshop. So I made like a little pottery skull, and it was just really fun to go with my classmates and kind of get out of that same routine every single day. And then, yeah, so usually my day does go from 10 to 5 each day, and then I do independent study. But I also did want to talk a little bit about what it looks like to prep for the med skill sessions because I know those are very different. And when I was coming into the med skill sessions, I was really nervous about them. So for everyone to kind of understand medical skills is when we have like a simulated patient come in, and on Tuesdays we practice our OSCE checklist with them. So each week we have a different physical exam we're doing, and so if it's abdominal week, on Tuesday you would be doing the abdominal examination on the simulated patient. So on Monday nights, I usually meet with a little study group so that we can go through the process of what that physical exam looks like so that we're prepared for Tuesday. And I find that being able to actually walk through the process of each step, comparing each other's notes on what red flags look like and what to watch out for is really important so that when we come into session on Tuesday in our small groups with our simulated patient, we actually are going in with a good understanding of what we're looking for and how the physical process looks like of going through that examination as well, so that you're well prepared, you can get the most out of that learning session.
What study tools do you use? If it is an iPad or a laptop, like what are your resources or apps that you find?
Mostly everyone uses their laptops or iPads, and a lot of people like to have that like tablet aspect because then they can draw on their notes, like their PowerPoint notes as well. But there are still people that do take hand notes, and again, that's totally a personal choice, right? Um, for me, I definitely take notes on my laptop as well. I find that that's the easiest way for me to get down the information, especially in lecture, the most quickly, because I can't write it out as quickly as I can type. So when I'm following in class and lecture, I usually use my Google Drive. I have that broken down into different courses, and then I put in like Monday large session group for week 9. And that's kind of how I title each of them so I know which week it's corresponding with. I type out my notes. And one thing that I really recommend is to, if you have access to the presentation beforehand, go in and kind of transfer that material over into whatever format you need it. So for me, I liked typed out notes because then I can use those notes and kind of format them as I want to. So I go into the PowerPoint presentation the night before, have that transferred on to my document, Google document, and then in class I can just add in what I need to, what's being like supplemental communicated through our professor. So I can just add that in. And then when I go home and I'm actually doing the studying process, I am able to retain the information a lot better when I actually physically write it out. So I have this online written out copy, and when I'm going through the material and reviewing the slides, I write out the things that I have trouble understanding or need to memorize. So for example, if there are statistics or, if I'm looking at certain blood work and I want something to fall within a certain range, remembering those ranges can be difficult for me. So I like to write them out. And the other tool that I like to use for things that I just need to like quickly memorize is Anki. I know some of my classmates use Anki a lot more for all of their courses. For me, it doesn't work for every course just because I find that I don't have time to make all of the slide decks, although there are different methods of now making slide decks, which I might play around with to save time. But I do make Anki for the quick rote memorization material that I need. So it's really a combination of things. Like I'm doing written out learning, I'm drawing a lot on my whiteboard and on my tablet as well, or I'm just doing passive reading and then the Anki as well. So it's a bunch of different methods kind of coming in together in one place, which I think benefits me. It just depends on what type of learner you are. And I know that all of us having gone through undergrad have been able to learn what works best for us. Maybe it takes some time to rediscover that after a break. Like I had a few gap years between PA school, but you do pick up back on that pretty quickly, and finding the best method for you might take time, but once you do, it's great because then you can stick with it and it works throughout each week, which is nice.
And I know that studying medicine in PA school, it's a little bit different. There's a lot of information to the point where it's so overwhelming. It's like, I guess the metaphor is like trying to drink from a fire hose.
Yeah, I hear that
Uh,
all the time.
yes. So, how would you say that studying in undergrad is different than studying in PA school? Or how has it been different for you?
I feel like there's so many differences from my experience in undergrad to PA school. Um, I think the way I even approach learning the material and going through the material is so different. In undergrad, I feel that everything was so broad and like big picture, and I can appreciate that for sure. But in PA school, I think I'm really gearing into the material that I've always been so passionate about learning. So I have this different excitement about the material that I'm learning, which is great. But again, you're right. There is so much material being thrown at you in PA school because you just have such limited time to learn that material. I think the main difference for me is kind of how I view it. So in PA school, the material I'm really looking at like if I had a patient coming in, um, what are the main things I want to know, right? Like, what are the main things I want to make sure that they don't have? What are kind of the differentials? How can I differentiate between different red flag symptoms? Those are like the main, most important things for me. So being able to kind of take my time to focus on that is really important. And then I would also say that learning in PA schools different because you're presenting your skills as well, right? Like it's not just a written test. Uh, that can that can be a part of it. We do have our weekly quizzes on Friday, so we do need to learn material for that. But it's a lot about learning why you're doing certain things and why certain things matter. So, for example, when I'm doing the OSCE, being able to know like, why am I doing this test? What does a negative in this result mean? And why would it happen? So when you start asking those questions and knowing the reasoning why, I think it's really important. It is really important, but it helps you learn those skills more quickly and then make connections within diagnoses. So like if I'm looking for a certain a positive in a certain test, like if I know why it's happening, then I'll remember to do it in the OSCE. But in addition to that, I'll be like, oh yeah, these three tests that I'm going to be doing kind of clump together to find the same outcome. Like for example, there's multiple ways of knowing if someone has some issues with their appendix. So if I can kind of recognize what the multiple ways of doing that is and know that multiple tests to do that, then I can kind of clump that together in the OSCE, and that helps me as well. Learning in the PA program is definitely very different from undergrad, and it takes time to adjust to it, but everyone kind of finds their way of what works for them. And I would say teamwork and collaboration, like working with small groups, is a big part of PA learning. Like I didn't do that as much in undergrad, but it's definitely like a daily thing in PA school.
For the group study or group learning, is that formalized groups, or are you and your classmates forming independent study groups?
It's actually a bit of both, which is really cool. I did mention that one of the reasons I wanted to come to Calgary was because I knew that they would have that formalized group learning. I know that that works really great for me. So for our med skills, we have small groups that they put us into for each semester. So we're working in small groups to the first hour of med skills we take to kind of go over the material for that examination. So if it's an abdominal examination, we'll go through and be like, what did you think were the red flags? Oh, cool. I read that you can do a SOAS test this way, but I read that you can do it this way. Like there's different ways that you can do certain things, and there's multiple ways that are right. So being able to learn from each other is super great. And often I find that with my classmates that are paramedics or have been nurses or have worked in healthcare for a lot longer than I have, they're able to provide me with a lot of the like tips and tricks of how to perform this maneuver the best way. And I learned so much from watching them. So I love the small groups for that reason. And then we also have small learning groups in the afternoons to go over patient cases. And so that would be kind of like that problem-based learning as well. We're given a case, this is the patient, this is what they're presenting with. What do we need to know to kind of figure out what's going on with them? What labs and tests are we going to run? And then how are we going to deal with their treatment and management, right? So again, that's a formalized group setting as well. They put us into groups for that too. And we're really able to learn from each other again, which is really, really cool, taking the material that we learned from class, but then learning from people's lived experiences of, hey, we need to really take into consideration the social aspects of their health in this case because they're a new immigrant and maybe don't have all the resources that they need to really support themselves throughout this healthcare journey. And so being able to learn from other people is the best experience, I think, and being able to even share my experiences, whether they're personal or from my studies from health sciences and disability studies in my course, I think is helpful for other students as well. And then, as you mentioned, we can also do like out of school informalized group learning. And my friends and I definitely rely on that as well. I think it's hard if you don't do that, because when you're coming in to med skills or even the OSCE, we were practicing together every day or every other day. And it really just helps you learn the maneuvers, fall into the muscle memory of how to do things. But also maybe someone has a really cool mnemonic of how to learn this certain, like, you know, the medications for a certain disease. And so you're like learning from other people, these tips and tricks. And I find when you are taking the time to even explain things to other people, like concepts and theories, it helps you learn it better, but then also it benefits their learning too. So I definitely do a lot of group learning, whether that's on the weekends or those Monday afternoons with my friends. And I find that, you know, not only am I learning more, but also you're going through the process together. So it helps you kind of have that social aspect too, which is great.
You also get exposure to clinical placements as well as a PA student. Can you tell us a little bit about what that experience is like?
For sure. So we actually just had our first shadowing days, which was really exciting. I talked to Anne a little bit about this because my shadowing was in an ortho specialty. So that was really nice. Right now, they are still trying to figure out the process of how to set up those early shadowing days. So, you know, my experience is probably going to be very different from the next class's experience. But right now, the way that it's working is that we have a designated week where we have allotted time that we can shadow. So they gave us a list of different specialties that we can shadow a PA in. It can be a PA, or I believe there were also like physiotherapists, doctors, surgeons, all of that. So you get to kind of sign up, and then you show up for your shadowing day, which is nice. But we also have the opportunity to set those up independently as well. So, you know, for someone like me that's coming from Ontario, maybe I don't have all of the connections to people in the specialties that I would like in Calgary, but that's where I kind of lean on my roommate, or not my roommates, my classmates that have been living in Calgary and studied here and work here for years. And so I can kind of create connections. And also with our professors that come in and teach, a lot of the specialists are open to having people shadow them as well. So that's kind of what I'm going to be looking into too. I think we're having another shadowing week in 2 weeks. So that's something I'm working on setting up right now as well. And in terms of the clinical placements for second year, I don't have too much information about that yet because that's something that they're still working on developing. But I know that we're going to go through the same rotations that the other PA programs do. And then there's that opportunity for electives at the end of rotations so that you can kind of get more experience in the area that you're most interested in right before you go into work as a PA.
That's wonderful. I'm so glad you get that hands-on experience and
Yeah.
actually see patient cases in addition to learning about them in the classroom.
Mhm.
Just being mindful of time. This was like amazing, just how much insight you're able to provide us in your experience as a PA applicant, then now as a PA student. What advice would you give to someone overall if someone is thinking of applying to PA school or is in the process of it?
I think my main advice would be to learn as much as you can about the profession. I was really lucky in the way that I reached out to people on Instagram and was able to get a shadowing experience prior to applying to the PA program, and that really just solidified my understanding of what a PA does and what it can look like in different environments, as well as is it a right fit for me? Because you are dedicating a lot of time, money, and effort into this program, right? So you want to make sure that it's a right fit for you. And the only way that I think you can really do that is by talking to people that are in that career path or shadowing and viewing it for yourself. So I would definitely say my main advice would be to get that experience of shadowing if you can. I know it is challenging to find them, but again, don't be scared to put yourself out there and ask that question on Instagram, on LinkedIn, whatever it may be, because the worst thing that can happen is that you don't get that experience, and that's okay. And the best thing that can happen is that you'll get a wonderful experience and you'll learn so much about the role and yourself throughout the process. So definitely put yourself out there, get that experience if you can. Um, and then in addition to that, I would also say make sure that you have a strong support system. Like it is throughout the application process, it is a huge journey. Like it is exhausting and can be overwhelming, and you're going through so many highs and so many lows throughout that process. Having family time was so important to me. Having my friends was also incredibly important. And maintaining those relationships now that I'm in PA school is also incredibly important. Those are the people that, I can call on a bad day, or I can call them when I'm having a really great day. And it just allows you to have that perspective of like, I'm a student, but I'm also a human first, right? Like I'm more than what's just going on within this year. I'm a daughter and a best friend and a cousin and all of these things. So you're more than just like a student. It's important to maintain those relationships. And especially when you move provinces, you can get homesick. Like I'm seeing that with my classmates. Sometimes I feel homesick too. So don't neglect that feeling. Make sure that you're really staying connected with the people that have supported you and make you feel most comforted.
That's amazing advice. Thank you so much. So if other students were interested in potentially getting in touch with you or with the Calgary Student PA Association, what would be the best way to reach you?
For me, you can definitely email me. My email is my first name dot my last name at UCalgary. So Nawal dot Arshi at UCalgary. You can also find me on Instagram. It's just Nawal underscore Arshi. You can message me there anytime. Honestly, I'd be so happy to answer questions about application process or how my experience is like at UCalgary. In addition to that, we have really great people working on our social media. So my classmates that are working on our social media account, they're awesome. You can shoot a message there and they can connect you with a student that's willing to share their experience or provide tips and tricks for your application as well. Okay, so Calgary MPAS, definitely follow us on Instagram. You can see what we do day to day. There's some great posts on there. I think you can also see like a post about our schedule if you're curious about our curriculum, which I thought was really neat. But yeah, you can message us on there. We can connect you with people that are able to email back and forth with you or hop on a call as well. So that's one way. And yeah, again, you can reach out to me anytime via email or Instagram. I'd be happy to help.